We have a camp for kids with type 1 diabetes and type 2 diabetes, and that's been around for over 80 years. So we've been in the community a really long time. Tell me what you know about diabetes.
That it can kill you.
It can kill you.
Yes.
It's preventable. It's preventable. Type 2 diabetes is preventable in many cases. This is true. What else do you know? You all know something about it. I know that you do.
Has to do with sugar levels.
Do sugar levels. How many of you know somebody that has diabetes or has diabetes yourself? Somebody in your family with diabetes? In the Hispanic community, 1 in 8 people have diabetes, so 1 out of every 8 people. So if we've got, I don't know, 16, 20, if we have 24 people here in the room, 3 of you have diabetes. And that number is growing by leaps and bounds. Any child born in the year 2000, any child born 13 years ago in the year 2000, will have about a 50% chance of developing type 2 diabetes in their lifetime. And this is the first generation of children who are not going to live as long as their parents because they have diabetes. Because like you said, it can kill you. But people don't die from diabetes, they die from heart disease or stroke or other issues related to diabetes. But what is diabetes? Does anybody know what it is? It's a chronic illness, and that means there's no cure for it. Once you get it, it's yours to keep forever. There's no cure for diabetes. It's a chronic illness that affects the way your body uses the food that you eat for energy. So when I eat my lunch or eat a meal, eat dinner, that food goes down into my gut and it breaks down into different components that my body can use. One of the components that it breaks into is glucose or sugar. We use those terms interchangeably, glucose or sugar. That glucose gets into my bloodstream and it travels around my body in my bloodstream. That's where we get the term blood sugar or blood glucose, and I know you've heard of that if you know about diabetes. That's where we get that term. So it travels through my bloodstream, and we need to get it out of that bloodstream into the cells where it acts as energy. Glucose or sugar is your body's source of energy. Just like a car needs gas to go, your body's cells need that glucose for fuel. So we got to get it out of the blood and into the cells. And we do that with the help of something called insulin. Insulin is not a drug, it's a hormone. It's produced in your pancreas, which is a gland right behind your stomach. When I eat food, my body will put out the right amount of insulin to get that glucose out of the blood and into the cells where it belongs. If you have diabetes, that's not happening. Your body is breaking down that food, it's breaking it down into glucose, but your pancreas is either not making any insulin, or the insulin that it makes is not being used the right way, or you're not making enough of it. So that glucose or sugar builds up in your blood, gets higher and higher and higher because it can't get into the cells. It needs that insulin to get into the cells. So it builds up higher and higher and higher. A lot of times people will remember their blood sugar number when they were diagnosed. Do you remember your blood sugar number? Nope. My nephew was, well, here's what normal is. Normal blood sugar for somebody without diabetes is under 99. My nephew, when he was diagnosed, was 1,250.
Oh.
And he was lucky to survive that. That's what he was when he was diagnosed. So a lot of times people remember that number. But that's what diabetes is, high blood sugar levels, because your body can't get the glucose out of the blood into the cells where it belongs. So what do we do? How do we do that? How do we make that happen for people that have diabetes? Lots of different ways. But let's first talk about the symptoms of diabetes and some risk factors for diabetes. People who are older, the older you get, the more likely you are to develop diabetes, although we're seeing diabetes develop at younger and younger ages. So the older you get, over the age of 45, even though we still see it at younger ages, people of color, people who are overweight, people who are not active, who don't get up and move, people who have heart disease or high blood pressure are at more risk for developing diabetes. Some of the symptoms of diabetes are feeling very thirsty. You just can't, you drink it and drink it and drink it. Anything that gets in the way of your hands, you drink it, drink it, drink it, but you just can't quench that thirst. It's not like a thirst on a hot day. You're drinking anything in your hand. You're up peeing a lot. What are some other symptoms of diabetes? Frequent urination, intense thirst, sometimes feeling very hungry. You just can't get enough food in you. You're very, very hungry. Feeling very tired. When your blood sugar levels are high, you feel tired. Even somebody that has diabetes already, if your blood sugar levels get high, it takes your energy away. Sometimes a change in your vision. Maybe you're not seeing as well as you used to see. You can't read the fine print. These are some symptoms of diabetes. With type 1 diabetes, we have 3 different kinds of diabetes. Type 1, type 2, and something called gestational diabetes. Type 1 diabetes tends to develop in children, usually before the age of 30, but it can develop at any time. More likely in children. My nephew was 21 when he was diagnosed, and I know Diane said her son was 13 when he was diagnosed. So it can happen at any time, but usually with kids. In type 1 diabetes, your body doesn't make any insulin at all, so you need to take insulin injections. You take it with a syringe, you take it with an insulin pen, you can use an insulin pump. There's different ways of getting that insulin in you, but you need to get the insulin in you, or you're not going to survive. It's pretty cut and dry. Type 2 diabetes is the most common type of diabetes. 95% of people with diabetes have type 2, and that develops usually as we get older, but we're seeing that develop at any time, and we're seeing a rise in type 2 diabetes in children. And that's really alarming because I said earlier, you usually develop after the age of 45. So if you have a 10-year-old kid developing type 2 diabetes that is something that their parent would have developed, then their lifespan can become quite short. And they can develop all sorts of complications like heart disease and high blood pressure that you wouldn't see in a kid. You don't see those things in a kid. Type 2 diabetes, the most common type. Your body is making insulin, but it's either not making enough or the insulin that it makes isn't being used the right way. So maybe you need to take insulin, maybe you're taking other medication to control your blood sugar, you're watching what you eat, and you're getting up and moving. And that's the same thing with type 1. You have to take insulin, but you also watch what you eat, and you also get up and move. The third kind is called gestational diabetes, and this develops in women when you're pregnant. It's the only kind of diabetes that goes away. Usually after the baby's born, blood sugar level will normalize, but not always, but most of the time. And the diabetes goes away. But if you have diabetes while you're pregnant, gestational diabetes, you have a 50 to 60% chance of developing type 2 within 10 years. So it's another one of those risk factors. And again, with moms, insulin, sometimes oral medications to help control the blood sugar level, but eating healthy and getting up. So that's how we manage diabetes. Medications if needed, healthy eating, get up and move, and then checking your blood sugar level. Has anybody ever seen anybody check their blood sugar? Yeah? What do they use? How do they do it? That's it. You have such a soft voice. Yeah, prick your finger. Okay, you prick your finger, then what do you do after you prick your finger? Put it on a little strip, and the little strip goes in a machine, and then it gives you your blood sugar level. That's called the blood glucose monitor. And it's about, for those of you that haven't seen it, it's about the size of your cell phone, or even smaller than that. Some of them are like just half the size of your cell phone, little tiny things. And that tells you what your blood sugar level is right now. So what's the big deal with that? By knowing what your blood sugar level is at different times during the day, you can learn to manage your blood sugar level and manage your diabetes. That's it. If you test your blood sugar before you eat, it should be within a certain range. If it's not in that range, then you play detective and try to figure out why. If you test your blood sugar 2 hours after you eat a meal, it should be in a certain range. If it's not, you play detective and figure out why. Certain times during the day, there are certain guidelines that you want to kind of fall into. And if it's not, you have to figure out what's going on and then make some changes in how you manage your diabetes. So checking your blood sugar is important. Eating healthy is important. When I say eating healthy, it means something to me. What does it mean to you? Someone says eat healthy. What does that mean?
Not eating a lot of sugar or bananas or anything that converts into
Yes and no.
Portion.
Portions, yeah. Watching your portions, not too much, yeah.
Like balancing out like all the different topics on the food pyramid.
Okay. Looking at that food pyramid, or we don't use the food pyramid anymore. We change our mind every couple of years. Now we've changed our mind and we don't use a food pyramid anymore, but we use a plate. Have you seen that in school, a plate? Think of your dinner plate. This is a really good way to set your plate up to help prevent diabetes, like we said earlier. Think of your dinner plate, picture it in your mind, cut it in half. Half of your dinner plate is vegetables. The other half of your dinner plate, you cut that in half. So a half of that half, or a quarter of the dinner plate, is starches, and the other quarter is protein. And then you get some milk in there, or some kind of calcium, something for calcium, and then a piece of fruit. You think of your dinner plate that way, so that you're getting enough vegetables, you're getting some protein, you're getting some starch, and you're eating healthier. Getting a little bit of fruit in there. Now, you want to think about what you drink. Sugar-free beverages are a good thing, or beverages that don't have a lot of calories in them. Because, how many of you just drink regular pop? Right, like regular pop? Do you know how many, you're smiling. Do you know how many calories are in a can of pop, a can of Coke, or something like that?
140.
Yeah, 140, 160, somewhere in there. You're looking it up on your cell phone? No, okay. Somewhere in that range. Do you know how many teaspoons of sugar are in a can of pop? Yeah, it's 10 to 12, 14, depending on the teaspoons of sugar. That's a lot of sugar. That's a lot of calories that are what we call empty calories. There's no food value in all. It's just the sweet. So thinking about what you eat, or what you drink, is important. Water is always good. Sugar-free beverages is good. That's kind of what we want to do, so that you're not getting any carbohydrates or calories coming from food, or coming from water unnecessarily, or liquids unnecessarily. So we want to think about what we drink. We want to watch the portion sizes. We want to go more low-fat, because we know people with diabetes are more likely to have heart disease. People that live in the United States are more likely to have heart disease, so it makes sense that we go with a low-fat. Getting back to what you said about sugar, cutting back on sugar. Some foods that have a lot of sugar in them are also going to have a lot of carbohydrate. And remember, we said carbohydrates break down into glucose, and that's what causes your blood sugar level to rise. So we want to be careful of some of that. But the bananas are fine. Any kind of fruit is fine. It's the amount. Watch your portions. It's the amount. So having a banana as part of a healthy meal is a fine thing to have. Having any kind of fruit is a fine thing to have. And I always tell folks with diabetes, there's nothing you can't eat. I'll just show you how to do it. So we kind of think that people with diabetes, of course, should never have a piece of cake, right? And you never have a piece of pie, and ice cream is just, you don't do that anymore either. No, you can have anything, and I can show you how to eat that. So there's not a lot that you have to go without. There's some things like regular pop, or there's some things I would say, maybe not, or kind of hold back on, but you can eat anything I can eat. I just need to show you how to do that. You need to learn how to do that. If your blood sugar is not in good control, then you don't want to be eating. You need to get it under control, and a piece of cake isn't going to get it there anytime soon. But I can help you learn how to do that, and that's what I do on my days. What else do you want to know about diabetes? We've talked a little bit about